Hello friends, today we will see about the bronchoscopic management of a mucoepidermoid carcinoma of right main bronchus. As you can see from the CT scan here, there is a big tumor occluding the right main bronchus. So initially we performed a video bronchoscopy under general anesthesia. As you can see from the video here, there is a highly vascular mass which is causing the near complete occlusion of the right main bronchus, uh, which was initially diagnosed as a carcinoid outside. So initially we are intubating this patient with the help of a rigid bronchoscopy using the modified technique. At our center, we don't use telescopes for the rigid bronchoscopic intubation or for performing rigid bronchoscopic biopsies. Instead, we use the flexible bronchoscope both as a light source as well as a suction channel. Once the patient is intubated with a rigid bronchoscope, we are placing one Fogarty on the contralateral side to prevent the aspiration of the blood, as well as we are placing a suction catheter. This ensures the safety of the procedure and protect the lung from bleeding. Once it is done, now the anesthetist is instructed to keep the FiO2 less than 0.4. Following this, an electrosurgical snaring of the tumor is being done under the bronchoscopic guidance. Care should be taken to loop the tumor completely so that we don't leave the remnants at the base. Once it is done, a cryoprobe is now passed to extract this snared tumor. And as you can see from the video here, the cryoprobe is kept activated till the tumor is out, and the entire chunk of the tumor is now removed with the help of the cryoprobe. Following this, whatever the residual tumor that is present inside the airway is being extracted with the help of a 1.7 millimeter cryoprobe. Care should be taken to ensure the protection of the contralateral lung so that the bed is tilted onto the ipsilateral side as well as the head and down. Following this, now you can see we are using the double Fogarty technique, where essentially one Fogarty is passed through the working channel of the bronchoscope, whereas the other Fogarty is kept at the contralateral bronchus, and sequentially they are inflated and deflated to prevent the aspiration of the blood content. In addition to this, to control the hemostasis, an electrocautery coagulation probe is being used, and the FiO2 is kept less than 0.4 while this electrocoagulation probe is being activated. Once it is done, now you can see that the right main bronchus is completely recanalized, and since it is a tumor which is arising from the base of the airway, the coagulation also helps in preventing the recurrence. In this case, even though the initial bronchoscopic biopsy done at an outside center was suggestive of a typical carcinoid, in the end, the biopsy was suggestive of a mucoepidermoid carcinoma, which may need a surgical resection at a later stage. Thank you.